and welcome to KKM 7 o'clock news. I'm Katie Kwasinski, and tonight we will be covering day 13 of the zombie apocalypse. We have received thousands of your questions, and tonight we will be taking the opportunity to answer some of them. Stay tuned for interviews from ER Dr. Millie Kontich, Public Health Representative Kim Bonema, and survivor Katie Lime. Later we will also have a real-life interview with a zombie. Well, we've been waiting for answers long enough. Let's get started with ER Dr. Millie Kontich. Hello.
Thank you for having me.
Thanks for coming and answering some of our questions. I think we should start to clear this up, so let's get started right away. One of the most popular questions is, what exactly are the symptoms of the infection?
So the first thing you'll notice right away that would be like caught right away is your heart would beat fast, but you would have shallow breathing. Also, your muscles would tense up and your skin would turn into like a whiter color, like you would.
Okay.
Would it be like a natural color?
So they'd get more pale than they're supposed to.
Yes. And then the last thing would be you would drop into a coma, and that's when you would know right away that you're turning into a zombie.
That sounds about right.
Yes.
What is the progression of this then?
Well, the first zombie that you would turn into would be a beating heart zombie, and
Okay.
that would take 3 days to happen. And the second would be a cystal zombie, and that would be 5 days after you turn into a beating heart zombie. So.
Okay. What's the difference between those two?
So the beating heart zombie is that your heart's actually beating and you're technically living, but then the other one, a cystal zombie, is you're dead. Like your heart stops and you're dead and you can't do anything about it.
Okay.
No
So
cure. So.
what is the medical community pursuing by means of treatments?
They put a lockdown in the city so no one can leave their homes. So if there are any zombies outside that, when they infect you, if you're outside that, they would infect you. So if you're inside, you wouldn't get infected.
Okay, so you're kind of just hoping to slow the spread.
Yes. And if you find like anyone in your family or anyone around you is a zombie, you would call the hotline 1913, and the people there would actually take care of it for you, so you wouldn't have to worry about it.
Okay, well that's great.
Yeah.
Thank you for taking the time out of your workday to come and
Thank
talk
you.
to us. We will be right back after this commercial break to talk with PR representative Kim. Our next guest for tonight's show is the Public Health Representative Kim Bonema.
Hello, thank you for having me.
Thanks for coming and answering all of our questions. Our first one is, what should you do if your loved one has become infected by the ZA virus?
The most important thing is to call the hotline 1913. It has, on the other end, there are trained officials to come take care of the situation. Do not try to handle it by yourself. You can become infected very easily by touching an infected person. There's also the spider that can give you the disease from its bite. Do not handle the spider on your own. It is very, very easy for it to bite you. The hotline for the spider is 1915. Call it immediately if you see one. The last hotline, 1914, is if you see a zombie walking outside or anywhere on the street, and this one is definitely the one that you should not be handling by yourself. They are very strong, even though they seem rigid. They will infect you if you try to touch them.
Okay, so what should the community know about what's going on, and what is the government doing to help us?
Well, as you know, we are in the middle of a government lockdown where you must stay in your house, and it is essential that you do that. It is a hassle and a pain, but it is for your protection. And now that we have the vaccine to cure, we can come to your houses and give that to you, and we can slow down the rate of infection dramatically. And if you stay in your house, the sooner it will be over. And so it is absolutely essential that you stay there.
Okay, thank you so much for this information. I understand you have a government-issued public service announcement for us tonight.
Yes, I do. This is a public service announcement issued by the government. The ZA disease now has a vaccine. It has been made law by government that everybody in the country must receive the vaccination to protect themselves against the disease. If you or someone you know does become infected, contact trained authorities by calling 1913 to be transferred to a hospital immediately where they can now be treated.
If you keep this a secret, everyone in your house will be at alarming risk of being infected, and the initially infected person has almost a 95% chance of dying by day 5. The earlier cases reported, the easier and faster it is for that person to be cured. As always, call the numbers on the screen if you or someone you know has been infected, you notice a zombie outside, or to report a spider. Do not try to handle anything on your own. Government-approved vaccination teams will be starting vaccinating the public tonight. They will come to your house. Do not open your door if they do not show you the badge of ID that looks like the one on your screen. Stay in your house until the government lifts the lockdown restrictions, and hopefully, now that we have the vaccination, the situation will start to get better. Thank you.
What you just witnessed was a public service announcement by the government about the ZA virus. Now we have pathogen introduction. We are informing the public today that there is a pathogen spreading the country that transforms you into a beating heart zombie in a matter of 3 days. Then, a dead zombie 5 days after turning into a beating heart zombie. We have a very important information to discuss with the public. This virus has a number of symptoms, including fever, hair loss, muscle tension, eyes glazing over, increased heart rate, but shallow breathing, skin color change happening over a period of 3 days, and there will also be no initial symptoms until 24 hours. Here is a picture of an actual zombie that transformed. We also have a picture of the pathogen, including its antigens. Please take the necessary precautions so that this does not happen to you. Welcome back. Our last interview of the day is with survivor Katie Lyon. Katie Lyon, tell us your story.
Well, it started when I was in Brazil studying this new species that I discovered, because that's what I do for my job. And I was bit by this spider that I was studying, and I accidentally took it home. And
The spider?
yeah, because I didn't know
Okay.
what happened, so I took it home because I needed to show my boss what.
The scientific community?
Yeah, the scientific community about it. And it just all started when I went to Brazil for the.
So I understand that you actually contracted the virus. What was that like?
Well, I don't exactly all remember. My muscles just started to cramp up, and it really hurt. But everything else was pretty much in a haze because I don't remember.
So you don't even remember the days leading up to becoming a zombie? You don't remember what it was like to be a zombie?
No,
No feelings or memories?
nothing really. It just was all in haze. Like I said, I got my muscles cramped up, but otherwise I don't remember much about it.
What about afterwards? How did you survive this?
It was pretty much just luck, because after hearing other people that have gotten it, I realized that I got saved by luck, because I didn't get a vaccine. They didn't come up with it yet, so pure luck.
Must be a miracle.
Yeah, it really was.
Do you have any after effects? Anything that affects you now?
I'm kind of not 100%. My muscles still kind of
Understandable.
are sore every once in a while. Like, I'm not 100%.
Of course.
Because, like I said, it was luck, so,
Mm-hmm.
but other than that, I seem perfectly fine.
So what are you doing now?
Now, I'm pretty much just living my life. I'm still finding new species and doing the best I can to not deal with the cramping muscles and.
Well, that's spectacular. It's great that you're able to continue your work
Yeah.
after such great adversity.
Mhm.
Your story is amazing. Thank you so much for sharing it with us.
Thanks for letting me come on the show.
Welcome back. We're now going to cut to our newscaster Marie, who's currently on the streets about to have a crucial interview with a real-life zombie.
Hi, this is Marie Cook, and I'm here at Dwight D. Eisenhower Hospital with beating heart zombie patient Rose Smith. How does it feel to be a zombie, Rose? Does it hurt at all, like with your muscles? Can you say anything at all for us? Well, there you have it, folks. That's what it's like to be a zombie. Back to you, Katie.
Thank you for watching. This has been KKM News. Signing off, Katie Kuzinski.